Hello, I'm Sarah Parker, and I'll be speaking about patient involvement in healthcare. When we walk into the physician's office and wait in the room, we usually have the nurse ask what the symptoms are, and the doctor comes into the room and asks questions to confirm what we told the medical assistant. They then decide a plan for our health based on that information. Now imagine a setting where the physician asks what we think should be done and what we are comfortable with and what our opinions in coming up with a solution are. Have you ever walked into an office and walked back out and wondered how 5 minutes of speaking with the doctor made them decide what is best for us? Currently, patient input is not accepted by the physicians. Patients may be afraid to approach the doctor with any questions or concerns that they have. Patients have been feeling unsatisfied with the care that they've received based on these issues. A reason for implementation of this type of healthcare would be patients having higher satisfaction. There was a case proven in 2009 and 2010 that patients have a higher satisfaction when they are involved in their own care. Studies have shown patients are discouraged and will refrain from getting medical help because of this reason. Ethics is another reason. It's the right thing to do. It is right because it involves the patient in their own care, which is the reason why they are there. It improves informed consent procedures, and it ensures they receive the care, testing, and treatments that they need and that they want. Patients are more likely to adhere and follow directions and improve overall outcome in health. Barriers that may stand in the way of this implementation are more time with the patient can lead to less money for providers. There may be longer wait times between patients, smaller numbers of patients that leads to less money for the providers. There can also be resistance from healthcare professionals. Healthcare professionals are sometimes resistant to change. Providers believe that they know what is best and feel that there is no need or problem in current procedures. Patients' lack of education and understanding. Even though there are barriers and resistance to this change, there are different ways to remove these obstacles to create satisfaction for all involved. Breaking the obstacles and implementation. One way is to educate providers by creating educational workshops for healthcare professionals, implementing this idea in colleges and universities, by teaching providers before they're licensed or registered in their field of study, recruiting advocates for patients to explain their needs to providers, implementing incentives. While daily numbers of patients may drop, incentives are put into place for the professionals who adopt this type of health care. By educating patients, by providing educational paperwork, and making information more accessible to the patient. Putting all of this together, it is beneficial for the satisfaction of all involved. The patient will be involved, The provider will be involved. You're eliminating all unnecessary treatments, lowers cost, it's ethical, and it gives the patient a voice. These are my references, and thank you for listening to my video presentation.